I'm Dr Drew Cronin, Consultant Plastic and Reconstructive Surgeon at the Coastal Clinic, and today we'll be talking about abdominoplasty. Now, an abdominoplasty is also referred to as a tummy tuck. It's a procedure where excess skin and fat is removed from the front of the abdomen, and also the rectus muscles are repaired in the same procedure. There's therefore two groups of patients for whom an abdominoplasty may be an appropriate operation. The first group is someone who has lost a lot of weight and has symptomatic excess skin on the front of the abdomen. Sometimes patients will have rolls of skin that can cause rashes and skin breakdown. They may feel uncomfortable trying to wear normal clothing or any clothing that requires the wearing of a belt. The second group of patients can be someone who maybe has had multiple pregnancies or twin pregnancies or very large pregnancies and has had separation of the rectus muscles, even in the absence of a lot of excess skin. But it's an operation where both of those issues are fixed in each patient in the same procedure. Now, an abdominoplasty procedure typically a patient would stay in hospital for about 3 or 4 days post-operatively. An incision is made low on the abdomen in order to conceal the final scar, and all of the skin and fat is dissected all the way up to the rib cage. The rectus muscles are then repaired, and typically 2 drains are placed before the operative bed is broken to about 60 degrees, and all of the excess skin and fat is pulled down and then excised. Post-operatively, patients will wake in recovery in their post-operative compression garment. They would then go to the ward where they would recover over a period of 3 or 4 days. Typically, patients report that their post-operative pain is much better than they had expected. Upon going home, I usually tell patients to take it easy at home for another week or so afterwards, but they certainly feel comfortable getting up to get to the kitchen or to get to the bathroom. Most patients would feel comfortable going back to things like driving and doing the shopping at around that 2 to 3 week mark. I insist that patients don't do any exercise until about the 6 week mark. Patients will have compression to wear for the first 6 weeks, so they always have 2 compression garments, one to wear and one to wash. The drains hopefully are removed before the patient is discharged from hospital, but sometimes a patient might go home with the drain in for a couple of days post-operatively. The ideal patient for consideration of an abdominoplasty is someone who has gotten down to their goal weight. So I usually won't perform an abdominoplasty procedure on anyone who's still in the obese weight range. It's really an operation where they get a much better result being back at their normal weight and also have much lower risk of post-operative complications. They must also have ceased smoking beforehand and be in general health and have any other medical conditions well controlled. If you'd like to come and speak to me in person about abdominoplasty procedures, then please contact the staff at the Coastal Clinic, and I look forward to speaking to you soon.